Hello friends, hello family. Welcome to Clinical Medicine with Dr. T. So guys, in this video we're just going to do the management of hyponatremia. I think we are finishing this series of hyponatremia off now. Hyponatremia. So by now we know that hyponatremia is sodium that is okay, let's talk about the degrees, right? So we know that the normal sodium levels are between 135 to 145. Now hyponatremia has got degrees, or can be graded into mild, moderate, and severe. Mild, moderate, and severe. So severe would be something less than 125. Mild is something is between 130 to 134. 130 to 134. Then moderate would be between 125 and 129. And 129. That's millimoles per liter. So just to remind you guys that if you want to get, when you run a blood test, when you fill in the forms, the lab forms, make sure that you put the age and the sex of the patient. If you don't do that, they won't give you the reference ranges, and you might have issues interpreting. And also because some of these, they range from lab to lab, so you should know the reference ranges that your lab uses for everything, because it differs from lab to lab. Some is the same, but some there are differences. So mild shouldn't give you symptoms, usually asymptomatic. So asymptomatic, this can be asymptomatic, or you might have just mild symptoms, but here you should be having some symptoms, and the symptoms that the patient is going to have will vary from patient to patient, and also and how severe is severe. I mean, someone who's got a hyponatremia of 120 or 118, their symptoms might be different. So I think the more severe your hyponatremia is, the more symptoms you will have. And yeah, so let's just keep this in mind. Now let me just make space so that we can talk about the management. This will be maybe I should call it the basics on how to manage, because it's not going to be detailed, but what I want you guys to understand is, when you treat a patient with hyponatremia, always don't look at hyponatremia in isolation. Always look at the hydration status of the patient, because that's where it is. Look at the hydration status of the patient and link that with because if you try to interpret hyponatremia and try to manage it alone or in isolation, you're not going to win. So when you look at the results, think about the hydration status. Hydration status of the patient. Like, let's go back to our drawing. The reason why most of the times, the reason why patients develop hyponatremia if you have been watching this series, you'd understand now there are few patients that actually have a loss of the sodium. Most of the patients do not really have the loss of the sodium. They have a loss of fluids instead and not a loss of sodium, right? Or they have gained some fluids. Yeah? Like for instance, this is the plasma, and this is the extracellular space or the extracellular fluid, and this is the intracellular. Now let's talk about the patients that have got hyponatremia because of dilution. So let's talk about dilutional hyponatremia. Right? Essentially, what you have there is that you have a situation whereby you have your sodium electrolytes there. You've got a sodium electrolytes there, right? Now, because you have these electrolytes there, water is pulled, a lot of water now is pulled out of the cell. So the sodium that you have in the extracellular space is diluted. I'm going to make an example here. Let's say when everything is fine, is normal, for every sodium electrolyte or cation, there is one molecule of water. Let's say this is the normal. Now the minute you get water from the intracellular space, this ratio will change. Let's say now you have got something like this. For every cation of sodium, now you've got 4 molecules of water. This is highly concentrated compared to this one. So the sodium here is diluted. So if you take a sample of this, your sodium will appear as if it will appear normal. But if you come here, your sodium is going to appear low as compared to the molecules of water. So this is highly concentrated and then this is diluted. So if you take a sample here and analyze it, you are going to get hyponatremia. But you didn't lose sodium there. What you did, you just gained more water. And the water that you gained has actually diluted your sodium. Now it appears as if on the sample you've got hyponatremia. That's why these kinds of patients, when you manage them, you don't just give them sodium, but if you can give them diuresis, they will actually get rid of these excess molecules of water and then they will go back to here. Now your sodium is normal again.